We're happy to welcome back this morning to the show Dr. Tiffany Ahlberg with Ahlberg Audiology. She's become a familiar guest on the show, and we're so glad that she has. Good to see you.
Thank you for having me.
I'm glad that you've picked the topic today for tinnitus. First of all, I always pronounced it incorrectly.
No, it can be pronounced tinnitus or tinnitus.
Oh,
Either way
really?
is correct, yes.
I used to say tinnitus, but then
Well, you were right both times.
Okay. And I think a lot of people probably have had experiences with a little bit of ringing in their ears, but for most of us it goes away.
Right.
But explain what tinnitus is, then I'll ask you my question.
So tinnitus is a phantom perception that no one else hears, but we hear internally, and 1 in 5 people have it. But it can be described as ringing, it can be described as thumping, it can be described as wind noise, or it just depends. Most of the time, 90% of the people who have this also have hearing loss.
Okay.
Sometimes it doesn't affect their ability to communicate, so they may not notice it, but it usually will correspond, the sound that they have, with where their hearing thresholds have a deficit.
1 in 5 people, that's a pretty high number.
It is.
Does that mean that 1 in 5 of us also has hearing loss of some sort?
It can. Sometimes tinnitus, 10% of the population has it, just a burst of tinnitus. That doesn't necessarily mean hearing loss, but if
Okay.
it's a sustained ringing in the ear that is every day, then that is usually associated with hearing loss.
I have a distinct memory as a kid, and it's happened to me periodically, half a dozen times maybe in almost 50 years, but where I'll just all of a sudden hear this little high-pitched sound in my ear, and then it goes away.
Yes.
But that's what we're talking about, right?
It is, but for
But
a lot
prolonged.
of people, yes, this is every day, all day.
If you have those little bursts like I'm talking about, does that mean that you might be more prone to develop the condition later on?
No, 85% of women will have that periodically. So it is more common in women than it is in men, and we all have that occasionally. But more, and that is tinnitus. That's a burst of tinnitus, but not necessarily related to hearing loss.
So what is tinnitus exactly? When any of us hears that little high-pitched sound, what's causing it?
It can be blood flow in the inner ear, a deficit of oxygen in the inner ear. It can be a lot of different things that, and honestly, we don't know for sure.
They're still trying to figure it out.
But when we have that, that has been linked, hearing loss and some of these deprivation of oxygen, deprivation of blood flow can cause hearing loss, and so that can definitely cause tinnitus, but most of the time, if it's prolonged, it is hearing loss. The other, we don't know for sure.
Okay, so I guess then the great question people have if they're suffering from it is, how do you treat it?
The most common type of treatment, and you can see pills and you will see ads and you will see all these things, and I ask every patient that comes in that has tried these, has it helped? And I have never, ever had a patient that said it did. So the most common, if you look at the American Tinnitus Association, because they have an association that researches tinnitus, is sound therapy. So it can be, there are many, many apps. There's one called Zen Tinnitus. There's one called Resound has a tinnitus app, and there's all kinds of other apps out there that present a sound that will mask the tinnitus that we hear. Sometimes people, if they have a hearing loss, will get hearing aids, and almost always that helps.
Really?
If they have a hearing loss.
So does that mean then that in the course of your day, because there's just natural sound around you, you don't notice it so much, but then at night,
yes,
it's very noticeable?
Most of the time at night, it's when people are in a quiet environment that they notice it the most.
So something as basic as a box fan in your room, does
Yes,
that help?
a fan, yes, any type of noise, white noise. You want it to be pleasant so that it's not bothersome to you.
Right.
Otherwise, you'll focus on that, and that will be a negative thing.
Does it tend to, I guess 2 questions. One, is there a genetic component? If you had a parent who had tinnitus, are you more likely to develop it? And then 2, does lifestyle affect it? Are there things we can be doing now to prevent it from developing?
So hearing loss can be genetic, and because there's such a strong link between hearing loss and tinnitus, that genetic component component is there,
Okay.
but not necessarily just the tinnitus having a genetic component. Yes, they have done lots of research on activity, physical activity, helping tinnitus a lot because, again, you know, blood flow, oxygen levels, all of those things help with the inner ear.
So exercising is good for your ear like it is for your heart?
Yes, definitely.
Is that something that you should be exercising as a preventive, or that if you, obviously that, but if you have tinnitus and you can begin an exercise routine, can it possibly at least keep it from growing?
Yes. And tinnitus is always worse at the onset.
Really?
Because of our fight or flight phenomenon that we have, where we have an adrenaline rush as, what is this? Do I have a brain tumor? You know, why do I have this ringing in my ear? And we notice it more when it first starts. As we get used to it, or we find out that, hey, it's just related to hearing loss, or, you know, it's not a brain tumor, or it's not anything that's, you know, bad, then we get used to it and it kind of goes away.
But does it, not to stir the pot, but does it have a psychological component?
Yes.
Because you can't get rid of it.
It does. It does. And that is one of the things that we have to talk about and counsel people on a lot is sound therapy, trying to not pay attention to it and create a sound that is pleasant for people to focus on so that they're not constantly paying attention to the tinnitus, because it is a cycle. You hear the tinnitus, you have an adrenaline rush, it gets worse, you pay more attention to it, and that cycle just keeps going.
Okay, before I let you go, real quickly, 30 seconds left, can it also impact younger people?
It can, well, yes, because of all the noise that people are exposed to. And we've all been to something loud, and then after the concert or the loud noise that we're exposed to, your ears will ring for a day.
Right.
And that's damage to the inner ear. The same thing that, you know, people have when they have hearing loss happens after a loud concert or noisy activity.
Okay, let's get you to her office if this is sounding like something that you or someone you know is dealing with, or you just know that you need to get that baseline hearing exam so you can know where you stand. Ahlberg Audiology on North Ocoee Street in Cleveland. 641-0956 is her phone number. Online, ahlbergaudiology.com. Thank you.
Thank you, Julie.